At the end of last lecture, we had been talking about classical conditioning, and we had talked about the course of taking a stimulus, something like our tone here for our tuning fork, or we had been talking about using a bell, and that previously neutral stimulus, because we had said that a bell or a tone doesn't actually mean anything to a dog at the beginning. And so that neutral stimulus, it would evoke no salivation response because it doesn't mean anything to the dog. We also have an unconditioned stimulus, our US. In this case, it's going to be food. And so if you give a dog this unconditioned stimulus of food, you don't have to teach them that food is something that they're going to eat. They're going to produce that unconditioned response, unconditioned meaning it's something they didn't have to learn, and that response is to salivate. So the dog starts drooling because they've been given that unconditioned stimulus of food. And so during conditioning, we're talking about our acquisition phase, if we're using the correct terms. We're going to pair our conditioned stimulus, or what is at the beginning a neutral stimulus that's becoming a conditioned stimulus. So our bell or our tone, we're going to pair that with our unconditioned stimulus, here our food, and we're going to present them together. And so over time, the dog is going to start learning that association between our conditioned stimulus and our unconditioned stimulus. And during this conditioning process, during this acquisition phase, the dog's producing an unconditioned response. So they're drooling, and because it's an unconditioned response, we're saying that they're drooling because of our unconditioned stimulus. So before they've actually learned the association between our conditioned stimulus, our bell or our tone, and that unconditioned stimulus, our food, they don't really care about the conditioned stimulus. So during this process, they're paying attention to the unconditioned stimulus and they're salivating in response to that. And so as we've said last class, our responses, whether conditioned or unconditioned, are going to be the same basic behavior, in this case salivation. We're just going to label it based on what is evoking or causing that stimulus response. So an unconditioned response is being caused by our unconditioned stimulus. And then we can see later on, after that conditioning has taken place, if we take our previously neutral stimulus, what is now our conditioned stimulus, our tone or our bell, and we show that to the dog or play that for the dog, we'll see a conditioned response. It elicits a conditioned response. So the dog is still salivating in response, but because the conditioned stimulus, that bell sound, is what's causing that response, we're going to call it a conditioned response. So to tell the difference between a conditioned and an unconditioned response, you're going to need to pay attention to what it is specifically that's causing that response, whether it's our conditioned stimulus or an unconditioned stimulus. And so we had gone through sort of our standard classical conditioning procedure, and then we had gone into what's called higher order conditioning. And so this is the idea of taking another neutral stimulus and training up a response here. And so beforehand we have a black square, which is a neutral stimulus because to a dog, a black square doesn't mean anything. So if you show a dog a black square, you're going to see no salivation because that square doesn't mean anything. During our higher order conditioning, we're going to use the stimulus, the conditioned stimulus that we set up in our last setup. So here our tone that became a conditioned stimulus. And that is going to be our conditioned stimulus that we're pairing with our now neutral stimulus, the black square. And so during this higher order conditioning acquisition, we're going to pair that neutral black square with our conditioned stimulus of that tone, and we're going to be seeing salivation. And it's a conditioned response here, specifically because it's being caused by our first trained conditioned stimulus. But the cool part is that after we've gone through this higher order conditioning, after the acquisition phase is over, when we show that dog the black square, which used to be a neutral stimulus, we'll actually see it become a conditioned stimulus because the black square alone is able to elicit salivation. So it gives us a conditioned response. And so, like we had said during the last lecture, this is basically how a lot of advertisements work. And we use specifically the example of alcohol advertisements, where they try and associate their alcohol, their product, with a bunch of really attractive people at a party that looks fun, because we have already been conditioned to think of attractive people at a party as being a good thing and a thing that we might want, a thing that we might enjoy. And so then if they're associating their product with a thing that we have learned to associate with something we'd like or enjoy, then we should transfer that learning and associate that new product, again, as something that we might like and enjoy. And so that's how higher order conditioning can be used to get you to think and view things just a little bit differently than you might have expected. So advertisements of all kinds make use of this type of conditioning. If we want to talk about some other applications of classical conditioning, the next couple of slides are going to list a few very similar techniques. And most of these are going to be different ways of dealing with helping people get over, say, phobias or problems, fears that cause problems in their lives. So the first of these is exposure therapy. And exposure therapy gives you extinction of the CR, our conditioned response, through exposure to our conditioned stimulus, the CS, without the presence of the US. So same as the extinction process that we talked about normally, you can use exposure therapy to help create extinction, to have that reduction of responding to a conditioned stimulus by having that conditioned stimulus presented without our unconditioned stimulus also being present. So the unconditioned stimulus would be something that causes you fear. So maybe your unconditioned stimulus might be a feeling of falling. So you're afraid of falling because you're in a high place. So our unconditioned stimulus is that feeling of falling, which then creates fear, our unconditioned response. Our conditioned stimulus, the thing we learn to associate with that feeling of falling, might then be sitting in a high place. So if you're like me and you're not a fan of high places, if you're standing too close to the edge of, say, a balcony, maybe you have a conditioned response, a learned behavior where you have this fear of falling because you have this conditioned stimulus of being in a high place that you associate with this unconditioned stimulus of falling from a high place. But exposure therapy gives us extinction because you would then go and sit in a high place for a very long time without actually falling. That's the important part of there is no unconditioned stimulus. There is no falling to create fear. And so you can start lessening your conditioned response because you can sit in that high place without actually feeling the thing that causes your fear. And you'll notice that this pattern is what a lot of these are going to be. So our next one is systemic desensitization. And so this is when you're facing a fear-inducing stimulus, again, something that makes you feel afraid, instead of focusing on specifically the exposure to our conditioned stimulus without our unconditioned stimulus, we're going to tell people to focus on muscular relaxation and sort of slow exposure to a fear-inducing stimulus. So you're going to encourage people to put their body in a relaxed state while slowly exposing them to more and more of the thing that causes them fear. And so in that case, you could have your unconditioned stimulus being the thing that's causing you fear, or if the conditioned stimulus, the thing you've learned to associate with the thing that causes you fear, causing more problems, you could use that as well. But what we care about for this is that you're forcing your body to relax, that muscular relaxation, and a gradual, slow exposure to things that scare you. So you are trying to desensitize yourself. You're getting rid of that sensitization that can happen. And you're doing it systemically by forcing your whole body to relax. And of course, there's lots more details and lots of research that have been done with all of these types of applications, but we're just doing the Coles Notes version, just one sentence for each, because we don't have tons of time to spend on each of these. So for our next two very quick applications of classical conditioning, instead of taking our slow process with this systemic desensitization, the idea of gradually working your way up to not being afraid of something, we can go to flooding. And this is kind of the other extreme, where it is a full exposure to a fearful stimulus. The stimulus that causes you fear, instead of sort of gradually working you up to seeing it and desensitizing you to it, they try and overexpose you to it. They show you so many scary spiders that you could never be scared by a normal spider again, because a single little spider is nothing compared to having seen hundreds of them. And so maybe a little bit controversial, not everybody agrees with this technique, but flooding and this sort of overwhelming exposure to the thing that causes you fear can sometimes cause a reduced experience of fear in the day-to-day life. And then our last one is more just a tweak on some of the stuff we've talked about, and this is a VR exposure therapy. So just like at the beginning, we were talking about exposure therapy and slowly, again, working people through the extinction of an association between our conditioned and unconditioned stimuli. We can do it now using technologies, so virtual reality, to help people sort of see and experience something that causes them fear without actually physically putting them in danger. And so this can be a useful tool to help people with phobias, especially things that they might not necessarily want to come in contact with. So you could use VR exposure therapy for fears of spiders, or I suppose falling if you really wanted to and couldn't get somebody to sit on a high ledge. So it's a nice low risk way of exposing people to fearful or fear invoking stimuli without actually putting them at risk. All right, and so the last little section is all about phobias and fear. And so phobias being fears that are specific to a particular thing. So I've talked about a phobia of spiders, arachnophobia, where you have this sort of crippling fear of spiders. You can have agoraphobia, a fear of being out in the open or in crowded spaces, all sorts of phobias. And so those are specific to a particular situation. And fear just being a more general things that frighten us. And so we're going to talk about a case study here, which is one of the most famous case studies in all of psychology. And this is about little Albert. So this young child in the picture here is little Albert. He started partaking in research at 11 months old, which should start raising some thoughts about maybe research ethics and consent and informed consent. And those flags, we'll talk about why those are important later. But what happened here was that little Albert's mother brought him in, and he was entered into a study looking at phobias and fear. And so the plan here was to show little Albert a white rat, just a plain old lab rat. And originally, when he sees a rat, he doesn't associate anything bad with it. It's pretty much a neutral stimulus to him. So he doesn't mind interacting with it. He doesn't mind the rat being around. But if you read ahead a bit, the presence of this rat was paired with the sound of a hammer hitting a gong. So a big, loud, booming sound. And as a young child, a sudden and startling sound like that, that's something that's going to cause fear. And so any time that little Albert saw or touched this white rat, somebody would go and hit this loud gong, and he would start crying because he was afraid. And so you can see where this is going. They paired that white rat, which was a neutral stimulus, with the sound of the gong, which would have been our unconditioned excuse me, our unconditioned stimulus, and that would produce a fear response, our unconditioned response. And so over time, that white rat becomes our conditioned stimulus. And seeing the white rat would produce a conditioned response of fear and crying. And so once they had established this link, once they had formed this association, once little Albert had acquired that relationship, they wanted to test and see if he would generalize, if he would have that same fear response to other objects. And so they tested him with a bunch of stuff that they could find. So they had blocks, so a bunch of wooden blocks, another rat, a rabbit, a dog, a sealskin coat, cotton wool, and a Santa beard. And they found that for a fear reaction, he ended up generalizing to absolutely everything except the wooden blocks. And so the thing that all of these have in common is that they tend to be sort of soft and fluffy. And so he had a highly generalized fear response to furry things. Anything that fit in that category, he would have that really intense fear response. And as you might imagine, that's a pretty bad thing for someone who's 11 months old to have developed. And this is where the story takes a not so great turn. Little Albert's mother pulled him out of this study and left. And they never went through an extinction process, at least not officially, not within that lab. And so perhaps he went on to live through his life, not having gotten rid of this irrational fear, this phobia now of things that are furry. So I encourage, if this is something that interests you, you can look this up. And there's quite a bit to little Albert's story and figuring out who he was and what happened from there. Though I will warn you, it isn't necessarily a happy ending, which is why I stick to just the one study. But yes, like I said, you can look that part up if you are so inclined.